Good evening, class, professor. My topic tonight that I'll be discussing this evening is water fluoridation. Water fluoridation is defined by the Center for Disease Control as the adjustment of fluoride concentration in the public water supply. The purpose of doing this is to reduce tooth decay and promote community oral health. Fluoride is defined by the EPAs and the minerals that communities are allowed to dissolve. The Center for Disease Control claims that it can prevent and even reverse tooth decay. However, recent research by the National Research Council has designated fluoride as a potentially harmful compound. My main claim for tonight is that the costs associated with water fluoridation outweigh its limited benefits. Costs in this case refer to both financial expenditures and cost to community health. The first supporting claim that I'm going to make is that water fluoridation is an outdated practice. My second claim will assert that the risks that water fluoridation poses to community health are numerous. And my last claim will show why water fluoridation is costly compared to other preventative health measures. I'm going to show examples of more effective, less costly alternatives to water fluoridation. Some background information on community water fluoridation. 60 years ago, water fluoridation was first endorsed in the United States as an effective, safe, and equitable means of improving public oral health. The CDC named water fluoridation a top 10 intervention for 20th century modern public health. However, recent doubt and concerns from officials over fluoride's costs, benefits, and health effects have been raised. In 1986, the journal Nature questioned the alleged enormous benefits of fluoride in water. And recently, the National Research Council in 1996 reported that standards for fluoride were dangerously high, causing some alarm in communities. The cost to communities and the cost to human health are causing some municipalities to rethink fluoridation programs. My first point is that given the historic context and current research, water fluoridation is an outdated practice. Dr. Paul Connett, an environmental chemist, points out that the benefits of fluoride are topical. When it was first implemented years ago, scientists and doctors did not understand this. He asks why populations should ingest a semi-toxic compound when it could be applied directly without harm. Another journalist from the BBC, Christopher Bryson, asks why historically countries without fluoridated water, such as some in continental Europe, have comparably low rates of tooth decay. This study published in Nature also shows comparable oral health despite fluoridation. Water fluoridation as a practice began long before the advent of widespread access and knowledge to preventative care. So without modern medicine, is it economical and safe to continue the practice of water fluoridation? The dentist named Louis Ripa writes and reports that fluoride was embraced as a social health panacea for all social classes when first implemented, but today it should be re-examined in light of less invasive alternatives. Modern research claims that water fluoridation poses numerous risks to health. The National Research Council reports and recommends that the current standard of 4 parts per million should be lowered to 1 part per million, which is the level that is naturally occurring in most water sources today. According to Time magazine, this means that continuing to fluoridate local water above natural levels is potentially harmful to community health. Another article reported in Scientific American encourages some local officials to scrutinize fluoride. Overconsumption could raise risks of disorders affecting things such as teeth, heart, brain, and thyroid. Researchers from the National Research Council who released these findings claim that fluorosis is a deeper indicator of overexposure. Fluorosis is a condition which shows spotting on the teeth. It's most common in children, and ingestion of fluoride for children and elderly is discouraged by the National Research Council. This furthers the claim that water fluoridation in fact does pose health risks. Finally, water fluoridation is costly compared to other preventative health measures. The American Dental Association admits that tooth decay is caused by refined sugars and not by lack of fluoride. Cavities can be prevented by healthy diet and good hygiene, which are equally effective and attainable without ingesting fluoridated water. Some non-fluoridated communities near Sacramento have programs that are administered in schools. These are safer alternatives than having children ingest high levels of fluoride. Fluoride coats and protects the tooth without forcing the child or community to ingest fluoride. Fluoride rinses are often administered in school nurses' offices and are equally effective in preventing cavities in children. Some U.S. cities are trending toward the elimination of water fluoridation programs. The town of Kaiser, Oregon recently hired a consulting firm to calculate the average cost of water fluoridation, and it determined the annual cost for this very small city to be up to $80,000 a year. Voters, after learning this, voted to eliminate it to trim the budget. Another consulting firm for Sacramento realized that up to $836,000 could be saved annually if the water fluoridation program were cut. The fiscal savings due to water fluoridation are contested, but eliminating water fluoridation programs can keep budgets trimmed and externalities to health down. To summarize, assuming that fluoride is as miraculous as 1950s era medicine would have us believe, its effectiveness would warrant its widespread use on a massive scale, despite its cost. However, in light of new studies that contest its efficacy in water, as well as its harmful side effects, its widespread use is not cost-effective for water municipalities trying to manage expenditures in the public interest. Thank you.